Good evening, doctors. Today we are going to do a very important subject preventive and social medicine. Why this subject is important? At least 25 questions are definitely coming from this PSM, and if you do it well, the chances of your score increasing and getting a good rank increase a lot many fold. So let's begin with the first question. Savlon contains A. Cetrimide plus chlorhexidine, B. Cetrimide plus chlorhexidine plus butyl alcohol. C. Cetrimide plus butyl alcohol. D. Cetrimide plus cetavlam. So the correct answer here is A. Cetrimide plus chlorhexidine. Savlon contains chlorhexidine gluconate, that is hibitane plus cetrimide in various percentages. Identify the vector given in the figure. A. Louse. B. Soft tick. C. Culex mosquito. D. Sandfly. It is definitely a louse. So correct answer here is A. Louse. Which of the following trace element has vitamin E-like action? A. Selenium. B. Geomycin. C. Copper. D. Zinc. It is selenium. Selenium deficiency causes Cashion's disease. Human milk is rich in copper, selenium, and cobalt, but contains less sodium. So correct answer here is A. Selenium. The item shown in the figure is A. Shakir tape, B. Triage tape, C. Multipurpose tape, D. Wrist tape. It is a Shakir tape. It is used to measure the mid-upper arm circumference. If it is more than 13.5 centimeter, it is normal. 12.5 to 13.5 centimeter, it is moderate malnutrition. Less than 12.5 centimeter, it is severe malnutrition. So the correct answer here is A. Shakir tape. Cluster testing technique is useful in which of the following conditions? A. Sexually transmitted disease. B. Poliomyelitis. C. Measles. D. Smallpox. This sexually transmitted disease is cluster testing technique is used in sexually transmitted disease. So correct answer here is A. Sexually transmitted disease. Please click the link in the description box to join the 2-day Neet PG Breakthrough Blueprint Masterclass. Which of the following is false about intrauterine device? A. Multilode CU375 is a third generation intrauterine device. B. Copper devices are effective as postcoital contraceptive. C. LNG20 has an effective life of 5 years. Pregnancy rates of lipase loop and TCU200 are similar. So the correct answer here is multilode CU375 is a third generation intrauterine device. Multilode CU375 is a newer copper intrauterine device. The copper device comprises the second generation IUD. So the correct answer here is A. The number of Anganwadi workers supervised by a Mukhya Sevika is A 10, 15, 25, 30. See, Mukhya Sevika is a middle level supervisor. She supervises 20 to 25 Anganwadi workers. She is required to be a graduate in social work or home science or related field. She is trained for 3 months. So the correct answer here is C 25. Minimata disease is caused by toxicity of A. Arsenic, B. Antimony, C. Lead, D. Mercury. It is caused due to mercury. A significant example of mercury exposure affecting public health occurred in Minamata, Japan between 1932 and 1968, where a factory producing acetic acid discharged waste liquid into Minamata Bay. The discharge included high concentration of methyl mercury. The bay was rich in fish and shellfish, providing the main livelihood of local residents and fishermen from other areas. So the correct answer here is mercury. International Red Cross was founded by A. Henry Dunant, B. John D. Rockefeller, C. Marie Curie, D. None of them. See, this Red Cross is a non-political international humanitarian organization founded by Swiss businessman Henry Dunant. So correct answer here is A. Henry Dunant. Please click the link in the description box. Go to the description. There a link is there. Click the link. You will join the WhatsApp group. You will get 2 days masterclass, which is absolutely free for you. And please like, share, and subscribe this channel. And please attend these challenges live. If you attend it live, If large number of people attend it, many people will be benefited. And please share the link with your friends so that everybody gets a chance to attend this. Swajal Dhara program is associated with A. Provision of safe drinking water, B. Provision of food supplement for destitute women, C. Provision of relief of victim of sexual abuse, provision of healthcare for sick tribe. It is provisioning of safe drinking water. Swajal Dhara is a community-led participation program which aims at provision of safe drinking water in rural areas with full ownership of community. It Which of the following screening method is used for under RNTCP? A. Active. B. Passive. C. Mass. D. All of the above. It is massive. Under RNTCP, active case finding is not pursued. Case finding here is passive. Patient presenting themselves with symptoms suggesting to tuberculosis are screened with two sputum smear examination. Dose of oseltamivir in a child aged 9 months is A. Oseltamivir is used in swine flu, 2 mg per kg per daily for 5 days, 2.5 mg per kg, 3 mg, 3.5. It is correct answer here is C. 3 mg per kg twice daily for 5 days. Rotavirus vaccine doses should not be initiated beyond which age to prevent complication? A. 6 weeks, B. 10 weeks, C. 12 weeks, D. 32 weeks. So this should not be given beyond 12 weeks. Two live attenuated oral rotavirus vaccines have been licensed for use. They are Rotatec and Rotarex. The first dose of these vaccines should be given no later than 12 weeks. In case of Rotarex, vaccination must be completed by 24 weeks. The dose of vaccine should be administered by 32 weeks. So the correct answer here is C, 12 weeks. Dukoral is A. Oral cholera vaccine, B. Oral rotavirus vaccine, oral typhoid vaccine, ready to use therapeutic food. It is oral cholera vaccine. Being's model of disease causation does not include A. Spiritual factor, B. Social factor, C. Religious factor, D. Nutritional factor. It is religious factor. Iodized salt in iodine deficiency control program is A. Primary prevention, B. Secondary prevention, C. Tertiary prevention, D. None. It is primary prevention. A person has lost his leg in an accident because of which he is not able to walk. This is A. Disease, B. Disability, C. Impairment, D. Handicap. It is disability. B. International disease surveillance is used for A. Hepatitis, B. Polio, C. TB, D. Leprosy. It is used for polio. So the correct answer here is B. Polio. Most important component of level of living is A. Health, B. Education, C. Occupation, D. Housing. It is health. Correct answer here is health. Attributable risk means A. Fatality of disease, B. Disease risk ratio between exposed and non-exposed, risk difference between exposed and non-exposed, communicability of disease. It is risk difference between exposed and non-exposed. So correct answer here is C. Parkinsonian bias is a type of A. Selection bias, B. Interviewer bias, C. Information bias, D. Recall bias. It is selection bias. Problem of bias is maximum with A. Cohort study, B. Case study, case control study, experimental study. It is case control study. Randomization is done to reduce A. Recall bias, B. Selection bias, C. Parkinsonian bias, D. Reporting bias. It is Parkinsonian. It is selection bias. Selection bias. Secondary attack rate is a measure of A. Communicability, B. Lethality, C. Strength of association, D. None. It is communicability. Secondary attack rate is important measure of communicability. So correct answer here is A. Communicability. Trans-ovarian transmission is seen in A. Rickettsial disease, B. Malaria, C. Filaria, D. None. It is seen in rickettsial diseases. This is a trans-ovarian transmission. Post-exposure prophylaxis is indicated in A. HBV, rabies, diphtheria. All. It is given in all. Amount of bleaching powder necessary to disinfect choleric stool is 50 gram per liter, 75 gram per liter, 90 gram per liter, 100 gram per liter, 50 gram.